हेलो गाइस, आज हम लोग सर्जरी का पहला चैप्टर देखेंगे, इंटीगुमेंट्री सिस्टम। तो इंटीगुमेंट्री सिस्टम क्या होता है? व्हाट इज इंटीगुमेंट्री सिस्टम? इट्स इन स्किन। इंटीगुमेंट मीन्स स्किन। तो हम लोगों को स्ट्रक्चर ऑफ स्किन को जानना होगा, बट ये हम लोग एनाटॉमी सेक्शन में देखेंगे। बट बेसिक्स जान लेते हैं। देयर इज 3 लेयर्स, दैट इज इन epidermis, dermis and subcutaneous. Epidermis is an outer layer, dermis is in middle layer as you can see there, and dermis is in true skin, and the third layer, that is an inner layer which is under the skin, that is a subcutaneous tissue. Okay, now आज हम लोग कुछ टॉपिक्स देखेंगे, जैसे कि फाइन निडल एस्पिरेशन बायोप्सी। ओके, इसमें हम लोग इम्पॉर्टेंट की पॉइंट्स देखेंगे। ओके, इम्पॉर्टेंट की पॉइंट्स ये है कि वी हैव टू सी इफ दे आर डूइंग द फाइन नीडल एस्पिरेशन बायोप्सी with or without guidance. Okay, we have to check the imaging guidance, whether it is an ultrasound guidance or whether it is an fluoroscopic guidance. Okay, the second important key points is we have to check the number of lesion. How many number of lesion is there? If there is an if we see the code like 10021, there is in first lesion. Okay, it is for the single lesion. If 10004, okay, for the additional lesion we have to give the 10004 additional code. Okay, and this is for the fine needle aspiration biopsy. Now, coming to the second topic of the integumentary system is incision and drainage. Okay, what is an incision and drainage? What is incision? It's an cutting and collecting. Okay, it means cutting and collecting of the what? If in a skin there is an wound, then we have to cut first. Okay, if there is a cyst in the skin, we have to cut first, and we have to collect the liquid from them. Okay, not just liquid, we have to collect it. Okay, so we have to see in part by part. Okay, first see for the acne surgery. Second is the incision and drainage. What is done? Acne is there, incision and drainage is there, incision and removal is there, or incision and no, it's a puncture of aspiration or incision and drainage complex. Okay, so we have to see in the questions like here 10040, acne surgery, marsupialization, opening or removal of multiple milia, comedone, cyst, pustules. We have to see the description. Now, the second one is incision and drainage. The main key point of the incision and drainage is don't code the without incision or without collection of drainage. We should have to code the both. If anyone is missing, then we should not append this code. Okay, and for the incisional drainage, we should use the modifier 52. And like 10060, we see na incision and drainage of the abscess, or and the 10061 is for the complicated. What is the difference between 10060 and 10061? It means simple or single, and the second one is complicated or multiple. So sometimes in the question the simple word is not there. Okay, and sometimes complicated word is not there. So we have to check with the packing or without packing. What is the meaning of packing? Okay, sometimes if cyst happening in our body, in our skin, then what physician do? If they do simply, it means they will not bandaging. Okay, they will not bandage the skin after incision and drainage. It means without packing. It means the wound is like it is, they leave the wound without packing, without bandaging. Okay, and multiple with the packing. This means complicated. Now coming to the second 10080, that is an incision and drainage of the pilonidal cyst, simple. Okay, and complicated. Here also simple and complicated. Now we have to see the parenthetical note in the 10081. What is written for excision of the pilonidal cyst? We have to see the code series 11770 to 11772. Okay, it is an incision and drainage, guys. But here, if sometimes question is what written pilonidal excision of the pilonidal cyst, and what we think that it's an incision and drainage cyst. We have seen that code, but no, we have to always check the parenthetical note and then we code. Now coming to the third point, that is in 10120, incision and removal of the foreign body, subcutaneous tissue, simple and complicated 10121. Okay, it's an removal of foreign body. Okay, if in the question is written foreign body removal of an incision. Okay, to report what is written in the parenthetical note, we have to see that. Always check parenthetical note. It will make easier to eliminate the options. To report wound exploration due to penetrating trauma without a laparotomy or thoracotomy, we have to see the 20100 and 20103 as appropriate. Okay, for the wound exploration, the musculoskeletal system should be coded. Okay. Now, to report debridement associated with open fracture and or dislocation, use 11010 to 11012 as appropriate. Okay, we understood that. Now coming to next code, that is 10140. That is an incision and drainage of hematoma, seroma or fluid collection. Okay, it's an hematoma, seroma, fluid collection. And the next one, 10160, is in puncture aspiration of abscess and hematoma, bulla or cyst. It's in puncture aspiration. Aspiration, physician, if there are abscess, if incision and drainage is not done, sometimes they aspiration. Sometimes they do aspire and puncturing the abscess. So we should use this code and check the parenthetical note. If the guidance is present, we should code the 70,000 series code. Now the 10180, that's an incision and drainage complex post-operative wound infection for second, that is an incision and drainage complex after the post-operative wound infection. If the wound is infection done after the post-operative, then the physician do incision and drainage again, and it's a complex procedure. Okay, for secondary closure of surgical wound, we have to see the 12020, 12021 and 13160. Okay, these series code we have to check.